Steves. Join me as we get better acquainted with the world each week on Travel with Rick Steves. Together, we'll explore fascinating sights, discover amazing food, and make new friends from near and far. Your radio is the only passport you'll need. Join us for Travel with Rick Steves. Saturday afternoons at 1 on KSJE.
This is Megan, your host for Radio Free Saturday Mornings, every Saturday 9 a.m. to 11 a.m., and you are listening to 90.9 KSJE Farmington. Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. It is Monday, August 24th.
You had to look at that.
I did.
I saw you.
I did. Well, you know, week number 20.
4.
4?
4.
Are you sure?
Yes.
Really?
Yes.
Did we skip 23?
No, 23 was last week.
It was.
It was.
You told me this.
Uh-huh.
Okay.
I told you this because we have on good authority, because we have a listener who is keeping track.
Right, but I thought it was 22. I don't know. I've lost.
I think it's 24.
A week somewhere.
Fact check us.
Oh, dear. Okay.
Okay.
But anyway, it's a long time. And here we are.
It's a long time.
But
That's
it's Monday,
I can't remember.
And we're here for our community information program about COVID-19, and so it's great to have you here. Great to see you.
Good to see you.
Yeah.
Yeah.
Monday.
Always a pleasure.
Thank you. And
this
and
is
for
what
you.
Say. Yeah, exactly.
With me.
Let me
for
teach you how this works.
Wait.
Okay.
Of course it is. Of course it is for you.
Okay.
Okay. That's how we're going to start.
Yep. Apparently.
There we are.
Okay.
All right. Anyway, we have some important information to share with people today. We're going to be joined by Jeff Bourgeois, President and CEO of San Juan Regional Medical Center. And we're also going to be talking about mental health. Some really good advice, I think, from Dr. Eva Boswell with San Juan Health Partners Behavioral Health. So looking forward to talking to her as well.
Yeah, it's going to be great.
So there you go. We'll start off with the numbers.
Yes.
Okay.
The numbers.
There you go. And we'll start off with testing.
Testing.
This week. So we can talk about that. I'm sorry. But anyway, we have testing today, this morning here at San Juan College from 7 to 8 a.m. Tomorrow in the evening here at San Juan College from 6 p.m. to 7 p.m. And then nothing scheduled for Wednesday, but on Thursday, August 27th here at San Juan College in the evening, 6 p.m. to 7 p.m. And Friday, August 28th in the morning here at San Juan College at 7 a.m. to 8 a.m. So testing all week long at San Juan College.
That's right.
Except for Wednesday.
Register before you arrive.
There you go. And there's the information again, cvtestreg.nmhealth.org, or you can call the coronavirus hotline in New Mexico, 855-600-3453. Or if you need help getting registered, 505-327-4461.
Great.
So that's the Department of Health. But they are still providing these tests again here at the college and throughout the county some weeks. And so it's, again, if you feel you need to have a test or want a test, one is available, again, free of charge.
That's right.
So there you go. That's part of the state's, I think, commitment to testing and to, again, being able to get a test for whoever wants one, which is a good thing. So now we can talk about numbers, right?
Great. Good.
Johns Hopkins.
Johns Hopkins.
Where are we?
U.S. confirmed cases are at 5,705,455. U.S. confirmed deaths is at 176,816.
Wow.
Yeah.
That's a lot.
It's a lot.
It is a lot. And we can see on the graph, again, the daily cases, the little kind of orange-yellow graph down in the bottom right-hand corner. We can kind of see the daily case counts and as the numbers have kind of peaked, and they're kind of on their way down, which is a good thing. But we still see and hear about hotspots around the country. But things, hopefully, states are getting a handle on this. I know we are in New Mexico, it seems like we are.
Yes.
So, and we can look at those numbers here. Yesterday, below 100 from around the state. Most of these new cases actually were in Bernalillo County, which of course is Albuquerque, the state's most populous county. But we're now at 24,396. 6 new cases in San Juan County reported on Sunday. For a total of 3,146. There were 2 deaths in our state yesterday for a total now of 745. None of those deaths were in San Juan County, so that number remains at 189. And the recoveries, again, up 227 at 11,539. So.
And I believe Bernalillo County, correct me if I'm wrong.
Oh,
which,
you know I
which
will. You
yeah.
know I will.
Exactly.
I'm just ready to.
You're ready to pounce, which is good journalism.
But you're never wrong, so that's okay.
Well, okay. Woo,
Yeah.
Wow. Okay, so anyway, that they decided to delay school until January. Like they officially said fall is
Albuquerque
online.
Public Schools,
Yes,
right,
Albuquerque
which covers
Public
most
Schools.
of Bernalillo County.
Yes.
That's true. Yes. So that's an
That's
interesting,
wild.
Yeah, decision. So,
Yeah.
because the whole state is saying not face-to-face till after Labor Day,
Right.
perhaps, but they've gone the extra step and just said, we're just going to do it online.
We're just
till
going to do it
January.
online. Yep.
So we'll see.
So good luck to you, Albuquerque.
Yeah, we'll definitely see what's going on. The other stories we wanted to share with you, of course, from KSJE.com. Again, here are the numbers, the more in-depth numbers from New Mexico. The Navajo Nation, again, 12 new cases reported on Sunday, and no additional deaths on the Navajo Nation. So again, their total numbers of cases are 9,547. And the total number of deaths are 493. So there's that story as well. And then we also wanted to pass along the story about our fellow college, Fort Lewis College. They were having students coming back to campus. Of course, they have on-campus housing, and
Yes.
so students come on campus. And they were testing students as they arrived, and they found 7 students that tested either positive or it looked like a positive, and so they have been asked to isolate. I believe 3 of those 7 had inconclusive results, and they were going to be retested to double check. But that was from their first week of kind of reopening and having students come on campus and being tested as they arrived, and they found 7 potentially positive students, so they're going to have to isolate now.
Happy first week of classes, guys.
Right. So there you go.
Yeah.
And that's what's going on up at Fort Lewis.
It's a mess.
So, yeah. And it's difficult when you have groups of
difficult.
people coming in from different areas. I mean, this is
Right.
a
And that
college where
on-campus housing.
where you're coming in from maybe other states, other hotspots, maybe not so hot spots, who knows?
Not so hot spots.
Yeah, that's a thing.
Which is hotter.
Yeah. Lukewarm spots.
Yeah, okay.
I don't know, but it's a concern.
Yes,
So,
yeah.
so there you are. But that's kind of what's been going on. So there we are.
Wow. And
Right.
it's the first day of school for San Juan College today.
It is
but
the
it's
fall semester.
Online.
Most classes are online.
That's right.
As we talked to the president last hour, some face-to-face classes for some things, like at the School of Energy, the School of Health Sciences, and the School of Trades and Technology, I think, are the 3 areas on campus that are maybe offering some face-to-face classes. As she was saying, there are some classes that are maybe a hybrid that are online, and then you come on campus for some face-to-face things, like a lab or something, and then you go back
Right.
online.
Right.
So that's how the colleges set things up. So
Good.
But there you go. Looking forward to it. I'm teaching 2 classes this semester myself.
That's right.
Yeah.
What classes are those?
2 public speaking, and they're full. 25 students.
Look at you. So popular.
I don't know about that. I think just the only thing that was available. Maybe.
What can we sign up for today? Oh, Scott Michelin.
Yeah, that sounds great.
That sounds good.
Sign
Let's
me
just-
up.
Let's just do that.
There you go.
I'm teaching too.
You are? That's right.
That's right.
What are you teaching?
End of life issues and rites and rituals of rituals and rites of passage. Sorry.
Oh,
So,
okay.
yes.
And these are
heady stuff.
Right. Are these Encore
These are Encore
community learning?
classes.
Yeah.
Yep.
Okay.
Yep, community learning.
Nice.
So sign up. Still time, guys.
You can sign up. There you
There's
go.
many, many, many interesting offerings. So
Right.
highly recommend.
A little bit of a plug. So
That's right.
That's good.
Yeah.
But I know we talked to Liesl Dees last week about Encore
Yeah.
in CLC classes. So
That's right. So let's talk Zoom real quick.
okay.
You ready for this philosophical point?
I don't know.
Hasn't life always been about deciding when and when not to mute yourself?
Oh. Interesting.
Yeah.
I think some people still haven't learned that lesson.
Exactly.
Right?
I know, but I was like, this is great.
Yeah.
I saw that on Twitter.
I like that. Mm-hmm. I think that is very, and anyone that's had to be in a Zoom meeting or class or anything knows of what you
Yes.
speak.
That meeting host needs to mute as they come in.
Yeah. True.
That's
Well, I mean, or
I
set it
run a
up.
tight Zoom ship.
Set it up on your Zoom to be muted as you join a
Right,
meeting. I mean,
that
that's
too.
what I do all the time. My camera's off, my mic is off until I'm ready to
That's right.
be presented.
Or presentable, as
That
it
too,
were.
right?
As it were.
Exactly. That's
Yeah.
very true.
Let's see. I learned how to do a Zoom poll the other day.
Oh.
Yeah.
Okay.
Yeah, that's cool. There's
Ask
all
people
sorts
what
of
they think. I know there's little built-in tools.
features,
Right?
yeah.
That's true.
So
Nice. Very true. Well, we are waiting for our first guest to call, and in the meantime, we could hear from our second guest.
yeah,
If you think we should do that.
I think so. Otherwise, they're just going to keep having to hear me pontificate over
Zoom.
things that I
Yeah.
have been thinking about.
So let me find that really quick.
So let's save our audience and
Okay.
find Dr. Boswell.
We can do that because again, talking about mental health, I think is an important thing. Because we have, as we've been talking about, people are staying at home. They're social distancing. They're physical distancing. They're not able to be as social maybe as they once
right.
were, and folks are, and kids
Right.
and adults and
That's
everybody
right.
are being impacted
Right.
by some of these
A
things.
lot of things that people once did to keep themselves healthy just aren't an option right now.
Right.
So
that's kind of what we want to talk to
Yeah.
Dr. Boswell about. So here we go, everybody. Joining us now to talk a little bit about behavioral health during these days of COVID-19, Dr. Eva Boswell is on the phone with us. She is with San Juan Health Partners Behavioral Health. Good morning.
Good morning.
Thank you for joining us. And so let's start by talking a little bit about what you are seeing with patients that are coming into your office or calling you about behavioral health. How are folks dealing with things these days?
Well, thank you for having me on. I greatly appreciate it. These days, we're actually seeing an increased level of depression and anxiety in the people who are coming in. A lot of people who might have, minor mental health issues, having some increased stress over things, work stress, life stress, stress with kids, have found that being home due to COVID and also having significant changes in their daily routine is causing increased stress and depression in some people. And what we're recommending is that, if you are experiencing that you call in, come into the hospital, either come in, make an appointment with our outpatient behavioral health and get care early. San Juan Regional is really dedicated to giving you really good care. They have a lot of appointments that we can arrange that are either by telepsychiatry, where you're seen through video for the first appointment, and some appointments in person, so that we're encouraging you to basically get care early rather than later. So that, you're taking good care of yourself, you're taking good care of your family, and understanding that this is a very, very stressful time for most people. And even people who don't normally have mental health issues can have depression and anxiety in times like this where there's increased stress.
great. So if I was an individual that, has never struggled with mental health issues, so might not know exactly when I should reach out for help, what is your suggestion there?
When you start feeling overwhelmed and you feel like you're maybe not functioning at the normal level that you would, some people are experiencing significant trouble sleeping, increased worry where they just cannot stop. They have, thoughts of worry running through their head. I've always considered anxiety as just an increased sense of worry where you have thoughts running through your head about the things that you need to do or can't get done. If you're having increased fear, some people are very afraid to go in public, afraid to leave their house, really afraid to engage in their, previous routines. We're encouraging everybody to wear a mask, to, take all of the precautions that, social distancing precautions. But if, you still have an underlying level of fear about going out in public doing those things, reach out. And we do, or if you're just not functioning at the level that you previously were, for example, struggling at work, struggling engaging with your kids, if you have kids and you're struggling with helping them get their homework done, struggling with the new education platforms, any kind of a change from your baseline life that you're not handling well is when we would suggest that you reach out. And for a lot of people, they don't need medications. They may just need to talk to a therapist once or twice to, discuss what the issues are that are going on and just get an extra ear to release the stress. And other people who have significant issues, we might suggest an antidepressant medication, just something to help with decrease the anxiety and stress level and get you a little help to get you on a healthier, back to your normal health.
Understood, Dr. Boswell. Thank you. And I wanted to ask you a little bit, too, about children, because I think we are seeing maybe some more cases of stress and depression amongst kids, and maybe harder to see. And is it harder to deal with? Can you talk a little bit about that?
So for kids, very definitely, it's a good thing to watch how your kids are functioning and whether they're having sleeping problems, whether they're having more emotional outbursts and episodes, if they're crying more, if they're fussier, or if they just shut down and become very reclusive. All of those are signs that your kids are struggling. They may be having depression and anxiety as well. Some of the tactics with kids and how to help them are, just really explaining what's going on and trying to understand, see through their view what they're experiencing. Some things that you can do to really help support them are to keep them on a schedule. Kids run great on schedules, so that if they know the next thing that's coming and the next thing that's expected, those things are very helpful. Even write it down on a whiteboard and have the schedule for the day. From 9 to 9:30, we're going to be doing this. From 10 to 10:30, we're going to be doing this. Also, keeping them active, getting them out of the house, with the proper safety precautions of, the masks and the social distancing, but taking them to the park so that they get some fresh air, get out, or able to run and exercise. Those are all very important. You can also do coloring and art projects with your kids to help relieve the anxiety. Those are some great things. There's also some kid online yoga programs that you can find on YouTube. And especially just getting your kids engaged in healthy activities around the house, helping them, creating a garden, helping them engage in healthy things that aren't necessarily in front of a screen, so that they're active, they're doing something that's keeping them engaged and limiting boredom.
Very good.
Things that you can do.
That's very helpful. I want to talk a bit about habit formation here, because a lot of our routines and habits have suffered because of this strange time we're in. And so let's talk about maybe suggestions for replacement habits, or what kind of habits can we form during this time that would be healthy for us?
So some of the things are actually habit formation. You can really integrate coping strategies in habit formation. Keeping yourself on a schedule is really good. Also, reaching out to the people who you used to be in contact with. For example, like, if you had a group of friends that you used to see on a very regular basis, make sure that you stay in contact with those people. It might be different than seeing them regularly, but, talking on the phone, doing a Zoom meeting, something like that, so that you still do have that social interaction. It might just be a little bit different. Also engaging in different hobbies, knitting, crocheting, if you're a woman, any kind of a hobby that is a healthy, sometimes woodworking, exercise, sports. They may not be group sports, but individual sports are really good things. Even if you can only do it 3 days a week for a short time, that will definitely help. Also, journaling and meditation. Journaling, a lot of people are finding that that's really good to just track what's going on, because this is an unprecedented time in our country and an unprecedented time of stress. And so journaling is a really good way to capture what you're feeling. Also, the routine of having good sleep hygiene is hugely important. And what I mean by that is that setting a bedtime and then making sure that you get a routine where you don't use electronics a half an hour to 45 minutes before bed. Making sure that you have a routine where you either take a shower, brush your teeth, brush your hair, get to bed and read a book. Use something without a screen and give yourself about 30 minutes to fall asleep. Your body runs on routine, and getting good sleep is a very huge part and a foundation for the basis of our life and for our mood. And so incorporating that is hugely important.
And Dr. Boswell, talk to me a little bit about maybe if we're seeing maybe problems with others in our friends or family circle, that maybe they are suffering from depression, or maybe they are having some difficulties. Are there any signs that maybe the rest of us can look for? Because many times it seems like someone has been depressed or someone's not doing so well, and we want to be available to them and help them through this, but we don't always pick up on the signs. Can you offer any advice for that?
So one of the things is just being very aware of the people that you're around and connecting with them and finding out how they're doing. And if they are becoming, more reclusive, they're not as engaged as they used to be, you're having trouble connecting with them, those are all, warning signs just to check in to say, how are you doing? Because a lot of people suffer in silence, and that's what we want to try to avoid, getting somebody who's being more reclusive, not engaged in what they used to do, and won't reach out for help. And if you do see that, it's good to talk to them, encourage them to come to San Juan Regional and get some help, talk to a counselor. We also have, I definitely encourage that everybody have the suicide prevention hotlines. New Mexico has a very good one. It's 1-855-NM-CRISIS, and they're 24 hours a day. Somebody's there to always talk. There's also like Talkspace is one. There's some apps like Calm and Breathe and Headspace that you can get on your phone that you can even help your friends engage with, so that they have an outlet. But the main thing is being present for the person that you're really concerned about and helping them through that process and encouraging them to get help.
Right. And of course that in normal times would be maybe a little easier to do, but these days when we're not maybe seeing them regularly and we're not interacting with them regularly, I mean, I think I get what you're saying is that we need to get into the habit of maybe even picking up the phone and making a good old-fashioned phone call to check in on these folks. It's about that easy, isn't it?
Yes, very definitely. That's exactly what I'm suggesting, is that if you haven't heard from a friend in a while and you haven't seen them, reach out through telephone, through a text message, through an email, even through social media if you're engaged in that, to check in on them to see how they're doing. A lot of people just a simple text message to check in to say, how are you doing? It can make the difference. A phone call, even if you can't get a hold of them, leave them a message. those little acts of kindness are really what can change the course of somebody who's having some issues, struggling, is that they know that someone out there cares about them, and that's huge.
Yeah, very good. Well, Dr. Boswell, we thank you so much for your time. We know that things are busy always for you guys, and especially maybe during this time, and so thank you so much for coming on.
I just wanted to stress that San Juan Regional is here for anyone who needs care. They are ready and safe to provide care. They have changed some of the protocols. We do expect everybody to come in with a cloth mask. They're mandatory. Visitors will all be screened for symptoms because we want to keep things safe. And for appointments, they can either be in person or online. And they have definitely done everything that they can to make sure that there's care available and that it's safe care. And so if you have any questions at all, you can definitely reference the website at sanjuanregional.com. And if you need behavioral health help, please reach out to San Juan Behavioral Health Partners.
Very good.
And be kind to yourself and others, because we're all in this together.
That is very true. Dr. Eva Boswell, thank you so much for joining us this morning. We appreciate it very much.
Thank you so much.
You're welcome.
Okay.
Dr. Eva Boswell, San Juan Health Partners Behavioral Health, our guest here on KSJE. And we are back here in the studios this morning, Scott Bickman along with Megan Collop, and good information.
Great information.
Because, again, behavioral health, mental health, a big deal during all this. And
Yeah.
I think folks may not realize maybe the impacts that this shutdown and stay at home and don't socialize are really having on people and their families.
Because as she touched upon, it can be a very sort of insidious thing that's going on in the background until people sort of hit a brick wall. And so they miss a lot of early warning signs.
Right.
So that was really helpful for her to, dig into.
Explain
there.
all that. That's right. That's very true. We have our next guest on the line, ready to go. And Jeff Bourgeois, the president and CEO of San Juan Regional Medical Center, is joining us for an update this morning. And Mr. Bourgeois, again, thank you for calling in this morning.
Hey, good morning, Scott and Megan. Sorry for being a little tardy, but it was great to have the chance to listen to Dr. Boswell. She did a great job.
She did a lot of great advice from her, and that's okay. You're not tardy at all because you're here right now. So we appreciate you being with us. Can you give us kind of an update on conditions at the hospital this week? We are hearing, Jeff Bourgeois, that the cases are down in San Juan County. Daily numbers seem to be down. Our state numbers seem to be heading in the right direction. Is that what you're seeing there?
Yes, very much so. We continue to see a decline in the overall positivity rate, the overall inpatient census related to COVID. It's bouncing around anywhere between 5 and 15 right now. Kind of goes up and down. We actually were down to below 5, I believe, for one short period last week. So we continue to see that decline, and hopefully it stays that way. Everything else is going well. We have our elective schedules open. We have 20 cases, OR cases scheduled going into today, and I'm assuming as normal it'll probably increase with add-ons and emergencies throughout the day. So pretty busy day on the procedural side for us. What we have seen, and it's not unique to us, in talking with colleagues and reading industry newsletters, is that emergency department volumes continue to be way down from pre-COVID experience, and that concerns us in that people perhaps are not seeking care when they may need it. So I think Dr. Boswell's points about, come to the hospital if you need care, and don't delay an emergency.
Sure. And I'm sorry to interrupt, Jeff Bourgeois, but I wanted to ask you about that emergency department numbers. Could part of this, though, be that we're just not moving around as much, and if we're not driving around, we're not crashing into things as much as we used to, and we're not having to go to the emergency department? Is that maybe some of this, or is it hard to really track down what could be the cause?
Yeah, I would hope that would be part of the answer, Scott. I hadn't thought of that. But we really just don't have any really any evidence about what it is other than anecdotal reports, widespread that people are coming to the hospital oftentimes kind of late in the course of an emergency, delaying care for stroke or heart attack interventions, and that's never good.
Sure, I understand. And that certainly would be something I know you and the other folks at the hospital we've talked to have been stressing, that we shouldn't be delaying any visit to the emergency department or urgent care if we feel we have a health problem. So I definitely understand that.
Yes, and I have a question about, as COVID cases go down, the hospital obviously has designated a whole COVID floor. As those cases decrease, is that space going to be transformed again into something else, what it was originally used for? Or is that space going to remain preserved in case there are these like second and third waves?
It's a great question, Megan. What we'll do is, until such time as COVID is behind us, we're going to designate a portion of the fourth floor as a respiratory unit. That will be the fourth floor ICU and what we call the fourth floor central part of our medical unit. That has 19 beds in the non-ICU setting and 14 in the ICU setting for a total of 33 beds. We can expand into other parts of the fourth floor if we need to, if there is a significant subsequent wave. And what we're learning, along with other hospitals, is that, with the flu season just around the corner, of course, we want to really stress everyone to go and get a flu immunization as soon as they become available here in the coming months. But respiratory patients will be, we will share the same precautions for infection control and isolate those patients all in one area in the hospital.
Great. And I have a question about the visitor policy. That's kind of that's been changing, but the last time we heard about that was a little while ago, and I believe it was one person a day. Has anything changed with the visitor policy?
Not yet, but we do have that under review. Of course, we would like to loosen that up as soon as possible, as I'm sure patients and family members would as well. But we're just using an abundance of caution. Family members can also, they're an important part of the healing process, as well as just being able to, offer support care there to their loved one at the hospital. So as soon as we can, we will loosen that up. But no changes as of today.
Got it. And Jeff Bourgeois, you mentioned earlier about some increasing activity in the operating rooms there at the hospital. Is this something that we're seeing, maybe elective surgeries coming a bit back more online, and folks are maybe opting to do some of these things that they put off when you weren't able to offer some of these elective procedures, or is this something different?
No, that's exactly it, Scott. Getting back into the routine of normally scheduled elective surgical procedures.
Got you. And we haven't talked a lot about PPE or those types of things, but we're hoping the supply chains have kind of replenished themselves, and the hospital is able to now acquire all the PPE that they need. It seems like that's part of the dashboard criteria that the state is monitoring about the gating criteria. Is that true at San Juan Regional? You've got all the gear and materials that your folks need on the job every day?
Yeah, we're in good shape with PPE, Scott. And thanks to the team that's been managing that, we've maintained an adequate supply of all the key items that caregivers need to protect themselves.
Very good. Well, Jeff Bourgeois, we appreciate your time, of course, and the update every week. And it's certainly, we appreciate talking to you once this is behind us, and we don't talk to you for a while. We'll miss you, but we'll look forward to that, if that makes any sense.
Yeah, it does. Well, listen, you all have a good day. Thanks for all the coverage you're getting to our team throughout this event.
We appreciate your team, and of course all the folks on the team that help provide us with guests and help schedule these things. We certainly appreciate it, and with you as well. So thank you so much, Jeff Bourgeois. Have a great week. President and CEO of San Juan Regional Medical Center, and we definitely appreciate his insights every time he calls us.
That's right, and it's been a little bit, so that was fun.
Know. Right.
I got used to Jeff every morning.
Every Monday.
I mean Monday morning.
Right.
Jeff in the Monday morning.
That's right. But that's okay.
Yeah, it's great.
We'd love to hear whenever he's available.
That's right.
He will have a spot on the show.
Correct. Friend of the show.
Friend of the show. That's right. Let's send him a T-shirt.
So, I know. I'm still thinking about those T-shirts.
Are you?
Yeah.
Okay. Good. I'm glad you're thinking about them.
Yeah.
That's good.
Amongst so many other things.
Yes.
Remember, the human brain wanders about 2,000 times a day.
Yes.
And I just go ahead and follow each of those rabbit holes. I don't even try to reel it in half the time.
I think viewers of this program would agree with you. They're not shocked to hear you say that.
Nope.
So there you go. All right. Very good. Well, anyway, I think we have wrapped up
Yeah.
the show for today. Lots of good information. Again, we thank Dr. Boswell for joining us and Jeff Bourgeois for joining us. And again, lots of good info. Share this again on social media if you feel this is important information to share with your friends and family, everybody. But we'll be back on Thursday, as we do, here on KSJE, again live on Facebook and YouTube Thursday morning at 9, a rebroadcast on KNMI Radio at noon, 88.9 FM, and of course a rebroadcast on KSJE Radio Thursdays at 5:06 p.m., 90.9 and 103.3 FM and KSJE.com. So until then, everyone, have a great rest of your Monday, and we will see you back here on Thursday. Have a good one. Bye-bye.